Welcome once again to This Week in Airline Safety and Security. I'm your host, Todd Curtis. Today is October 29th, 2014. In a number of weeks, there have been a number of very significant changes in policies when it comes to air travel restrictions and Ebola. Within the last week or so, the U.S. government tightened its restrictions on people traveling from the most hard-hit areas, specifically Liberia, Sierra Leone, and Guinea, requiring that everyone coming from those countries, directly from those countries, go through one of 5 entry airports and go through a screening process. In the last few days, state governments, starting with New Jersey and New York, placed additional requirements. In the case of those 2 states, specifically stating that medical personnel who had been treating Ebola patients would have to go into immediate isolation and quarantine. This caused some consternation, especially since the first person who was subject to this was not symptomatic, was not in a position to actually infect others with the virus. Those rules were quickly changed, but it brought up another issue. Other states started putting in restrictions, and in fact, a number of states, including states covering at least 4 of the 5 entry-level airports, had additional requirements for people who may have been in those areas affected by Ebola. This brings up a couple of questions in the minds of the traveling public, mainly, what are the rules going to be tomorrow? What other changes may be in the offing? And I'd like to explain a little bit about why that is happening. And the bottom line is there are several units of government that make independent decisions when it comes to public health and air travel restrictions. And they don't necessarily have to coordinate their decisions with other levels of government. They're free to do as they see fit to protect the public and their eyes. And in general, there are several levels of decision making in the U.S. government. The federal level, the CDC being probably the most prominent. You have the individual states, which includes smaller units within those states, such as cities and counties, that can make their own rules with respect to how the people who are infected with Ebola can be treated, can be restricted in their movements. Furthermore, you have the U.S. military, which not only has its own independent air transportation system, but has its own set of rules that it can enforce independently of the civilian government when it comes to their military members. Now, it's important there because, as we speak, there's a program in place where thousands of U.S. military personnel are in the hardest hit areas of West Africa, directly fighting Ebola by setting up hospitals and such. So there will be thousands of people exposed to those areas over the next few months. Now, another big decision maker, which can change policies, are the individual travelers themselves. The restrictions as they exist have quite a few ways that people can get around them. In other words, individuals can take some actions, including not telling the truth to authorities when they travel, as to where they have been and what they may have been exposed to. Now, so far, there has not been a case where a traveler who has either violated the restrictions that are in place or outright lied have flown to another country and caused Ebola to come to that country. And by the way, of the countries that do have Ebola, there are roughly 10,000 people who have been infected, roughly 5,000 have died. Virtually all of those infected and those who have died have been in the 3 most hard-hit countries of Liberia, Sierra Leone, and Guinea. And there have been 2 countries, though, where people have flown out of Liberia, flown to other countries who were infected with Ebola and brought Ebola to those countries. That was Nigeria and the United States. Now, that said, there may be some changes in the near future. Those changes may be very rapid. They could come on from the federal level, from the state level, from the military. It will probably depend on 2 factors. One, whether or not Ebola, for any reason, spreads widely throughout the United States. And 2, whether or not the systems as they are in place right now show serious deficiencies. For example, if it turns out that a number of people have been able to circumvent the restrictions that are in place, there may be calls to make them stronger in some form or fashion. Now, and again, to emphasize, there are limitations to each level of government. One of the key limitations for the federal government is that it controls only certain aspects of how the government operates. For example, they control air travel. They also control entry and exit into the United States. they have more limited authority, in fact quite limited authority, to restrict movement within the states once people are in country. And that's where the state and local governments often come in. Those health authorities from state and local governments often putting in restrictions well beyond what the federal government has done. So, in next week's show, we may have something quite different to offer depending on what may happen. But keep in mind, there are a lot of players out there. Each of those players can make their own decisions. And travel restrictions could change very rapidly and very unpredictably in the days to come. Until next week, for more information about Ebola, please visit ebola.airsafe.com, and we'll see you next week. Thank you very much.